when we look at the rehabilitation plan following an ACL reconstruction, this video will outline what we do for the first 12 months. For the first 5 months approximately, we'll go through and do the basic rehab program, which will include inner range quad, calf exercises, 3 glute exercises, 3 or 4 balance exercises, and a host of hamstring exercises. We normally start the hamstring, if we've taken the hamstring, at around about the week 1 or 2 mark. We can start these quite early. We'll get you doing a biking program throughout, which is also very useful, and that will be almost 3 to 4 times a week for 30 to 45 minutes. The cyclical loading on the bike is really helpful for cartilage to regenerate and also for movement in the knee and quad strength. The only time we wouldn't do a bike exercise is if you've had a suspensory fixation, and we don't allow that for about 6 weeks. If we do that in the first 6 weeks, the tunnel will start to widen. So we don't use that for suspensory fixation, but the rest of the ACLs, especially for screw fixation on each end, the PEEK screws, we start the bike pretty much straight away. It also reduces things like DVTs and so forth, and the likelihood of chronic regional pain syndrome. So when we get to and also bear in mind in that first 5-month period, we don't do squats, lunges, step-ups. It increases the likelihood of patellofemoral pain. Remember, patellofemoral pain is very common post-ACL reconstruction, and we tend to see this a lot when people do too many squats, lunges, step-ups, step-downs. So we keep it pretty simple and stupid in that first 5 months. We can continue to increase the load, the weights for the quad, the weights for the hamstring, etc., through that period, for that first 5 months. When we get to about 3 to 4 months, we can include a Smith machine exercise program, and I'll show you that. We'll send you that now. So the Smith machine can be included. Again, it's only a 0 to 30 degree range of motion for that. So we can start to incorporate combined movements of glute, quad, and calf all in one. So once we get to 5 months, we're then happy to go on to a pre-jumping program, which I'll show you, and that goes for about 2 to 3 weeks. From the pre-jumping onto an interval running program at around about the 5 to 6 month mark, and around about 6 months onto a full jumping program. And once we get to the 6 months mark, 6 to 7 months, and we've done the full jumping, we're then at around about 8 months happy to send you back to even hitting some tennis balls. A very simple non-competition, or if you happen to be a soccer player and you have training a couple of times a week, we're happy to go back to training in soccer or football, netball, rugby, but no contact. No contact and no match play from that about 8 months through to 10 months. So it's drills. So drills at training for about 2 months in the football, soccer, rugby. Then when we get to about 10 months, we can then start doing drills, match play. And at the 10 month for about 2 months, we start to get back to match play until we hit the 12 month mark. So if you sort of see it, when we get to 8 months, then we can have about 4 months of return to training. It sounds like a long period of time, but the reason being is because we know that specific match play conditions, building up your endurance and so forth, will probably take you 3 to 4 months, and it's a safer way to return to your desired sport. So in summary, the first 5 months is basic strengthening. At around about 5 months, we introduce pre-jumping, and after pre-jumping at 5.5 to 6, interval running, from interval running onto full jumping program, and then at about 8 months, back to training but no match play. And then once you get to the 10-month mark, then match play with your training until you hit the 12-month mark. We know that if you go back before 12 months, you increase your risk of injury, so we try and hold you off until that stage. And then the last thing is, if you're a skier, make sure if you go back to skiing that you don't have the ski binding that's too tight. Keep it below about 3.5. And this is a little bit of a summary of what we're after from a general rehabilitation program. Now, the last thing to mention is that there's many different ways to do an ACL, due to different sort of fixation techniques, etc. This is the stock standard, the best practice for our good graft choice types of patients that have non-suspensory fixation on both ends, as well as as well as no other major complications from a meniscus perspective. Anyway, this is a summary. If there's any questions, please don't hesitate to contact me at info@orthomedphysio.com, and happy exercising.